So when we're talking about cueing patients, or you have a new patient using these shoes, the first thing you want them to do is put on the shoe. It's very easy to do it. We have these finger loops. A lot of people miss the finger loops, but finger loops are here to get that strap open. The rest of the shoe is elastic. They can get their foot in. You can put your foot in actually just pressing your foot in, and a gentle little tug on the tongue gets it back up, and then you just flop this over and you're ready to go and start walking. The first thing that people are going to do is go from a seated position to a standing position after they've put on their shoes. So in order to do that, make sure that the patient is able to put weight on their feet and then push up like you normally would in a sit to stand. Maybe helping them the first time that they do this. The important thing when you're using the variable friction shoes is to ensure that you have a proper amount of weight down before you push up. You don't want your patient pushing outward because it does have a reduced friction without any weight. So push down and then stand up. Once you have your client in a standing position, the next thing that you're going to want to do is start taking some steps. Before that, we like to have people test the water. To do this, I have simulated 4 here. So testing the water means we want people to start to get the idea of what the variable friction means. So in order to do this, you have people just take their affected side and start to move the foot around the circular pattern, left, right, forward, backwards, and then step on it. Once they step on it, they're going to feel the traction start to grip the ground. So again, it's just move it around, push down, start to feel it. Start to feel it in different angles too, back, forward, right, left. This is going to start to give your clients some confidence before you have them to start walking. When somebody starts walking in these shoes, what I always like to suggest is you start by force dragging. What I mean by force dragging is you're going to walk with very straight steps using the low friction to drag as you take these 4 to 6 to 8 repetitions back and forth throughout your clinic. The reason that we're force dragging is that you're going to start to get the feeling of what the variable friction is doing for you. Once we're done force dragging, you want to start to have your clients still maintain those straight steps. We're trying to avoid the things like circumduction or hip hiking or anything like that. We want small, short steps that are going straight, walking with these shoes. They don't have to force drag anymore. They can if they want to, but they don't have to. Once we start getting that, the next progression would be, let's take a little bit of a longer step. Again, we're starting with short steps. The reason we start with short steps is because in a long step, you might have the tendency, depending on the patient, to roll over the front tip of the shoe. The front tip has friction on it, specifically designed so that people can toe off and push to the next step. If we made the low friction all the way to the tip, we'd lose some of this push off and have a potential to slip out. We don't want that. So by taking small steps, you ensure that your client is always on the slippery part as they're sliding forward and they don't get too aggressive. The angle is somewhere about 50 degrees to vertical, 55 degrees to vertical before it starts to stick. So you do have a good angular range here before we go. But in general, we take small steps to start, and we can start moving to bigger steps as we experiment with what feels good to us, depending on the different type of gait. The other thing I like to really start to work on once we get beyond that is the rhythmicity of gait. And rhythmicity, what I'm talking about is the timing. So it would be ideal as your client progresses to have a left step, right step, left step, right step, be a pattern like a musical beat. When we walk to this musical beat, it makes our walking look a little bit nicer, makes it feel a little bit nicer. And there's a good amount of neuroscience behind the fact that rhythmic motions might be a little bit different than discrete single motions as we start to walk. We want to train that back. So again, the progression would go sit to stand. Once we're stand, test the water. Once we've tested the water, walk with a force drag. Once we're comfortable walking with a force drag, start to walk without one or just normally as you feel comfortable. Then start to lengthen the steps. Try to maintain symmetry of step length left to right. Then try to build in the rhythmicity left, right, as if we're dancing to music. One person I told, imagine that there is a beat or actually have a beat. So if you have some music playing, let's walk to the beat. I think that's a really useful thing to do in therapy.